Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. We are doing the fibroid series and we have come to the topic of treatments. Here we are doing UAE today. What is UAE? UAE is nothing but uterine artery embolization. It is one of the treatment options for fibroids. So today we are going to discuss its benefits, what is the conditions that are required to perform this UAE, what are the benefits of UAE, what are the side effects or risks or complications of UAE, what are the treatment options other than UAE, and also we are going to discuss about the homeopathic treatment options for UAE. So let's dive into the topic to know more about. So what is UAE? UAE is called as uterine artery embolization, as we have already discussed, but it can also be called as uterine fibroid embolization. You know uterine, which is related to the uterus. You know the word fibroid, which is related to the condition, but you do not know the word embolization. What does this embolization mean? Okay, let me explain it to you in a very simple manner. As you can see here, this is the uterus and this is the fibroid, right? See, the fibroid grows because of its blood supply. Yes or no? So if you're cutting off the blood supply of the fibroid, you can shrink the fibroid. What does embolization means? They will be sending these small particles, as you can see here, these blue glowy particles. They will be sending these particles through a certain artery and they will come and attach to the blood vessels near this fibroid. They will block the blood supply of this fibroid, and this process of blocking the blood supply is known as embolization. Okay, so and this particles which are there, they are called as embolus. These are inserted by human beings into the arteries. Sometimes human beings also develop this embolus. What are these? If you are having a lot of lipids or a lot of fats, okay, you will develop this embolus, which is cholesterol in nature. Okay, bad cholesterol will start forming this embolus and it can block certain organs in your body. That is the reason why you might be having coronary artery disease, where the heart is receiving less amount of blood supply to its own muscles, because the fat, this embolus, which is in the form of fat, is blocking that artery. So you know what is embolus, right? Embolus is something which blocks the blood vessel, and embolization is the process where this blockage material is coming and attaching and it is cutting off the blood supply. This process is totally called as embolization. So here we are blocking the blood supply of the fibroid in order to shrink it. What are the conditions that are needed for this UAE to be performed? Okay, so first one is symptomatic fibroids. If you are someone who is suffering from fibroids and you do not have any sort of symptoms, noticeable symptoms, you need not have this UAE done. But if you are experiencing symptoms like too much of flow for longer period of time, that is flow for 15 days, flow for 20 days continuously, or even if the flow is only for 5 days but the flow is more, that is the amount of blood that is being led out of the body is more. If you are experiencing symptoms like this, if you are experiencing severe dysmenorrhea, which is painful menstruation, if you are experiencing any of these symptoms, you can get this UAE done. Apart from that, if you are someone who is very afraid of getting a major surgery done, you can get this UAE because it is minimally invasive. Okay, it is very the suturing or the puncture that we put in this UAE is very small, so you don't have to worry about that. Next one is inability to undergo surgery. If you are having certain medical conditions where you cannot undergo surgery, because UAE is a very minimally invasive surgery, you can undergo this one. An enlarged uterus. See, fibroids in certain section of people come in packages. For some people, they are just fibroid presentation, but for certain section of people, fibroids are associated with endometriosis, fibroids are associated with adenomyosis, fibroids are associated with polycystic ovaries, or even ovarian cysts, or even bulky uterus. What do you mean by bulky uterus? Bulky uterus is nothing but endometrial thickness is too much than required. This is bulky uterus. If you are someone who is experiencing bulky uterus, we have already done a video, a detailed video on bulky uterus, its treatment options, its investigations, causes, conditions, and all of that stuff. So if you want to view this video, the link will be provided in the description box. So if you're someone who's experiencing fibroids and bulky uterus, UAE can help you with it. Along with that, if you're someone who's experiencing anemia because of this fibroids, because of prolonged bleeding, if you're having anemia, then major surgery cannot be done. So UAE, which is a minimally invasive surgery, can be done. Apart from that, if you're experiencing bladder symptoms or constipation, see the fibroid, if this is the uterus, if the fibroid is falling on the anterior part or front, it is falling on the front part, it can cause pressure symptoms in the bladder, where you will have urge continuously to go to urine. Even smaller amounts of urine will cause urge that you have to go to, you have to pee. And also if you're experiencing constipation, where if this is the uterus and the posterior part of it, that is the back part of it, if the fibroid is in the back part of it and it is falling on the rectum, you can experience constipation also. If you experience either of these two symptoms, you can get UAE done. And pain during sex or intercourse is also one of the symptoms of fibroid. Along with that, if you're having pain on your back and your legs, if you're having the pain radiating, that is if you're having pulling down sensation in their hypogastric region, bearing down sensation, and that sensation or that pain is radiating or it's extending to the back, it's extending to the thighs, you are falling in under the criteria of this UAE surgery. As we have discussed already the conditions for UAE, now we are going to discuss the contraindications. There are certain conditions which will fulfill which have to be fulfilled for UAE surgery. In the same manner, there are certain contraindications also for the surgery. So let us view it. One is having active pelvic infection. If you're someone who is experiencing PID, which is pelvic inflammatory disease, then UAE is not for you. If you are right now pregnant and you are having fibroids, you cannot get UAE done. And if you are having any gynecological malignancies, what do you mean by malignancy? Malignancy are cancerous conditions. If you are experiencing cancerous conditions, then UAE is not an option. If you are having severe contrast allergy, if you have seen in the starting of the video, we have showed you that the particles, that the embolus, the blue color particles are shiny, they are radiant, right? Because there is some dye injected to it. So if you are allergic to that dye also, you might be experiencing severe anaphylactic reaction where you have to be hospitalized. So if you are having any allergies to that dye, you are not supposed to have this UAE dye. If you're having kidney impairment, that is if your GFR is very low. What is GFR? GFR is nothing but glomerular filtration rate. Because of any of the kidney conditions, it can be acute kidney disease, it can be chronic kidney disease, it can be hydronephrosis, it can be any sort of kidney related diseases where your GFR is very low, then UAE is not for you. And if you're desiring for future pregnancy, see, of course, UAE is a minimally invasive surgery and it does not involve in affecting the uterus. But if the procedure is not performed properly, it can harm the uterus, wherein the future pregnancy, cannot be expected. So it is a 50-50% chance. If you're getting it done in a proper hospital, and also if the surgery is 100%, it has been done properly and the results are good, then the pregnancy can be predicted. But if you are getting it done in through unsophisticated people or people who are not experienced doing that operation, and then if the results are not good, then the future pregnancy cannot be predicted. And uncorrectable bleeding disorders, this is very, very important in performing UAE. Why? Because you're puncturing an artery over here. How are we puncturing? Why are we puncturing? We are going to discuss in the procedure of this UAE. So we are puncturing an artery here. If you are having some sort of coagulation disorders like delayed clotting time and bleeding time, then your blood will start flowing, and because you're puncturing the artery itself, the blood coming out will be a lot more than the venous puncture. So if you're having clotting disorders, then you're not supposed to get this UAE done. And then very large fibroids. Remember, of course, UAE is a minimally invasive procedure, but the problem with this is if you're experiencing large fibroids, this is only for moderate to small fibroids. If you're experiencing larger fibroids more than 12 centimeters, UAE is not the option for you. Multiple abdominal scars and endometrial cancer. If you're having cancerous conditions or malignancies, and also if you're having multiple abdominal scars and endometrial cancer, and about endometrial cancer, we've already discussed it in the malignancy. But if you're experiencing multiple abdominal scars also, UAE is not the option for you. Coming to the investigations, there are certain investigations that are needed before this UAE surgery. So what are these investigations? The first and foremost is electrolyte count, which is very, very important for any kind of surgery. It can be a major surgery, minor surgery, very minimally invasive surgery also. So you need this electrolyte count, and apart from that, as we have already discussed, if your GFR is really good, then only the surgery can be performed. So if your GFR, that is estimated glomerular rate, is also measured. Next, coming to complete blood count, if you are someone who is experiencing iron deficiency anemia, or if you're having an active infection, by doing a CBC count, we will be able to know if there is any raise in the WBC count. If there is any raise in WBC count, that means you're having an infection. If there is rise in neutrophil, there is an active infection, or if there is any chronic infection, there will be rise in lymphocytes. Apart from that, we will be able to know your quality of the blood, which is very important for performing UAE. And then INR, which is international normalized ratio, which will count your coagulation time and your bleeding time or your clotting time as such. See, if you're having any clotting disorders, then it is not possible to perform this UAE. So by doing this test, we will be able to know if there is any clotting disorder. Apart from that, it is there we are going to perform a beta human chorionic gonadotropin, which is HCG, where doctor will be able to know if you are right now pregnant or not. So pregnancy is a contraindication for UAE. So this test is very important. Apart from that, MRI, which is very important, as USG scan can give you the dimensions of the fibroid, but MRI scan will be able to give you the proper dimensions, proper depth, proper width, and where it is located. In-depth knowledge of the fibroid will be given by MRI. So MRI is also very important prior to performing UAE. Now coming into the procedure part. So how is this UAE done? Very, very simple. As you can see here in the picture. See, there is an artery which is coming from the abdomen, and it will divide like this and come into the thigh. That is nothing but femoral artery. It's a little larger artery. So what happens is they just put a syringe, and through the needle they pierce the artery. Okay, they're piercing the artery, and from this artery what they will do is, as you can see here, they will pierce your artery, right? And through the syringe they will be sending you the embolus. Okay, and this embolus will start flowing, and a radiologist will be there continuously viewing this procedure. So a radiologist will continue viewing this procedure. The embolus will be directly like this to the uterine artery. Okay, and from the uterine artery what happens is, it will be directed here. Okay, and here it will come and it will block the blood supply to the fibroid. So this is the procedure where there is insertion or puncture in the femoral artery, and then there is direction of this embolus or this material which is dyed or it is luminescent, and this material is sent and is directed to the uterine artery, and then from the uterine artery it is sent to the capillaries which are supplying this fibroid, and they will block the capillaries. This is the whole procedure of UAE. It is very minimally invasive. It is just giving a little bit of puncture, small puncture to your femoral artery. Okay, but what are its benefits, we will let you know in the coming video. So next we will be discussing its benefits and also its risks. What are its benefits? First and foremost, it is minimally invasive. If you are someone who is experiencing anxiety just at the word surgery, then UAE can be an option for you, because UAE is very minimally surgical. And then it preserves the uterus, so you're not cutting down the uterus, or you're not taking down the uterus like in hysterectomy where the whole uterus is removed, right? So there is no harm to the uterus, and it can help if the surgery is performed in a proper manner and the results are coming as expected, then future fertility can be expected. Apart from that, typically it's a very short hospital period time. The recovery time is very short because it's very minimally invasive, and also there are good success rates, and also the symptoms are relieved. So these are the certain benefits you will be obtaining from UAE. Now let us see the imposed risks in this UAE. So what are the risks? Remember that if you're someone who's looking for treatment options, it can be any disease, it can be any form of treatment. The pros and cons should always be watched, right? So if your benefits outweigh the risks, then that is a better treatment option. But if the risks outweigh the benefit, then that is a poor treatment option. Here the risks are many. First and foremost, there is abnormal bleeding. If the surgery does not go as needed, there can be abnormal bleeding from the fibroid, and suddenly if the blood supply is cut off, the fibroid can change into a red degeneration. It can start becoming infected also. So there can be abnormal bleeding, there can be severe bleeding, or there can be stoppage of this bleeding, and there can be infection symptoms. So abnormal bleeding can occur, there can be occurring injury to the uterus. How can this uterus be injured in this? Remember, we are cutting the blood supply of the fibroid. Remember, this capillaries can supply even to the other parts of the uterus, right? So if you are cutting the blood supply of that part, the uterus will be harmed, and the uterus is harmed, it can go into necrosis. Necrosis is death of that tissue or death of the uterus, and if the death of the uterus occurs, it will go into putrefaction, which is bacterial infection, and then the uterus has to be removed, and then there is no future pregnancy. So if it is not, if the outcome of the procedure is not proper, then there can be injury to the uterus, and there can be infection of the uterus, and also there can be infection at the punctured site. Wherever you're puncturing that femoral artery, remember it's an artery and not a vein. So if you're puncturing the artery, there can be infection even in that puncture site also. And if you're having, if it is not done properly, and if you are having coagulation disorder, and if it is not priorly checked to the UAE, then that can cause a lot of blood to ooze. And also if it is not clotting properly, that blood clot or that blood will start pooling inside the thigh area, which can lead into hematoma. And the artery can be injured if not done properly. Remember, femoral artery is a very important artery in lower extremities. If that is injured and if that has blood clots, then it can shift somewhere, and that blood clot can travel throughout the body, and it can fit somewhere in the organ capillaries, and that organ can be damaged, which is one of the riskiest complication of this UAE. Let me explain to you through a picture. So what happens here, if the fibroid is here, okay, we are cutting the blood supply, right? So this is done, but what we are doing, we are harming the femoral artery, right? So whenever we harm this femoral artery, there can be a blood clot forming inside the artery. And remember, it is artery, so blood pressure will be more. This, whatever blood clot is there, na, whatever blood clot has formed here can get dislodged, and it can shift and come and block the liver capillary. It can block the brain capillary, it can block the heart capillaries, or it can block the stomach capillaries, or anywhere else. It can block anything. So wherever it is blocking, that will go into death, or death of the tissue can happen. So if the embolus, that is the blood clot, is going and getting stuck in the heart, then it can cause heart attack. If it is going and getting stuck in the brain, then it can cause paralysis. If it is going and getting stuck in the liver, it can cause necrosis of the liver or of the stomach. So the complications, I mean the threatening complications, are a little bit on a riskier side of this UAE compared to the normal hysterectomy or this myomectomy. So here is where risk of this UAE is a little bit more complicated. Apart from that, what else are the risk factors? Infertility. As I told you, if that embolus is attaching to the other capillaries, if the embolus is not directed properly and it's attaching to the other capillaries of the uterus, it can harm the uterus, and wherein the uterus death can take place, and there is no fertility issue itself. And it can cause loss of menstrual period. Sometimes it can cause ovarian dysfunction. So if there is ovarian dysfunction, then it can cause amenorrhea or menopause-like symptoms directly. So there can be premature menopause. There can be allergic reaction to the contrast material using in the embolus, which can cause anaphylactic reaction, which can lead into furthermore hospitalization. Blood clots, we have already discussed about it. Other than that, what are the other risks? Let us see. In some women, especially 90% of the women will be experiencing severe pain and severe cramping type of pain after the surgery. We have spoken to a lot of gynecologists. They suggested that many people do suffer from pain and cramping after UAE, but usually they do suggest painkillers. But remember, the painkillers also have certain side effects, right? And also, apart from paining and cramping, you will be having vaginal discharge. Sometimes if it is a submucosal fibroid and it is very small, it has a stalk attached to it, and after blood supply is cut short, the stalk can detach, leading to the falling of the fibroid through the vaginal orifice, or it can cause a lot of vaginal discharge as well. And there can be nausea, vomiting, low grade fever, fatigue and discomfort. All of this come under post embolization syndrome. So these are the risks of UAE. Next, coming into the homeopathic treatment part. So we have discussed what are the benefits of UAE, we have discussed the risk factors of UAE. As we have already discussed, if you are getting any sort of surgery done, it can be for any organ dysfunction, or if you are getting some treatment option done, we always view the pros and cons of it, right? So in the same manner, if the benefits of UAE are little and the risk factors are more, if you are just wanting to remove a fibroid and the embolus gets stuck in the heart and you have a heart attack, it is, utterly painful experience, right? So, and also that is something that you don't want to happen, because heart is a major organ. You have other treatment options for fibroids. I think the prominent treatment option for fibroid, other than an allopathic form of treatment where there is just removal of the fibroid but there is nothing done so that there is no reoccurrence of it, here in homeopathy you have all of it covered in one heading, that is just homeopathic pills. See, because this homeopathy is safe to use, you do not have any sort of side effects attached to homeopathy, and it is non-invasive. We are not performing any surgery here. And then there is fibroid shrinkage along with hormonal balance. This is something you should all be very careful about. If you are treating the fibroid has occurred, you're treating it, cutting it off, and then you're removing. It can be through myomectomy, it can be through UAE, or it can be through laparotomy. Any process, you are removing it, right? And after the removal, can you assure that you will not be again experiencing this fibroids? No. That is where homeopathy comes into play. Here in homeopathy, if you, after giving homeopathic medications, the recurrency rate of fibroid appearance is very low. And also, we are balancing the hormones along with shrinking the fibroids without any pain, without any destruction of the major organ. How are we doing this? See, the hormonal imbalance is the main problem for this fibroid to occur, and fibroids again will cause this hormonal disruption or hormonal imbalance. If you're not correcting the hormonal imbalance, then the fibroids will again reoccur no matter what. They are just like nasal polyps. You get a surgery done for nasal polyps, and they do again occur, right? In the same manner, here also in the fibroids, if you're not removing the hormonal imbalance, the fibroids will again reoccur. By taking homeopathic pills, it will correct your hormonal imbalance slowly, and further by it will alter your menstruation, where this prolonged menstruation or heavy flow, or very too much of profuse bleeding is there, all of that will come into control in a timely fashion. And also there will be regularized menstrual cycle. The treatment will be holistic in nature. How are we treating this hormonal imbalances? Remember that certain section of people will have hormonal imbalance for one cause, certain section for the other cause. Even stress can cause hormonal imbalance. So by taking your mental and your physical picture, anything that you're experiencing emotionally will be shown physically in the body. Both of them are connected. So by taking your mental picture and also your physical picture in case taking, we will be analyzing your personality pattern and your symptomatology pattern, thereby giving the medication which covers both of them, so that you will be experiencing cure in the most easiest and the safest manner. So we'll be able to prevent further recurrences, relieve your current symptoms, and cure your disease. So if you want to opt for cure, opt for homeopathic form of treatment for fibroid. Next, coming into the precautions part, which is very important. If you're someone who does not want to have a fibroid occurrence in the future, or if you're someone who's experiencing fibroids and do not want it to grow, or if you're someone who has got a surgery done and you do not want again your fibroids to reappear, these are some of the changes that you need to do. First and foremost changes you need to do is dietary management. Do not consume red meat. What does red meat include? It includes mutton, it includes lamb, it includes pork, and it includes beef. So do not consume any of this, and also do not consume a lot of soy products, because soy products can have phytoestrogens and some people are susceptible to it. So there, by decreasing the estrogen dominance, you will be able to control your fibroid size and also prevent their future recurrences. And if you're taking a plate every time you eat, just remember this formula. If you're taking a plate, divide it into 4 parts. Okay, the first and foremost part should have the green leafy vegetables. The second 2 parts of that plate should have a healthy amount of fats. What are healthy amount of fats? Take one handful of nuts and seeds, and then the other 2/4 part should be filled up with protein. You can include healthy portion of proteins like fish, you can include chicken, you can include tofu, paneer, chickpeas, rajma, lentils, anything of your choice. And the other 1/4 portion, you should have your staple food. It can be bread, it can be chapatis, it can be rotis, it can be your rice. So if you're eating in this manner, you will have a healthy lifestyle and also a healthy hormonal balance. Your body will be able to manage it properly because there is correct nutrition provided to it. Apart from that, you should be able to manage your stress by doing pranayamam, or you can do breathing exercises, you can do workouts. If you're someone who has a larger fibroid, I do not advise you to go for cardio. Instead, you can do yoga or yogasanas, you can do stretching, you can do mild weightlifting, and along with that strength training or core training, and also Kegel exercises. Do not do a lot of jumping or a lot of running or a lot of heavy weightlifting if you're someone who's experiencing large fibroids, as that condition can further increase pain. Apart from that, you try to maintain a healthy sleep pattern. If you're a woman of reproductive age, you need at least 9 hours of proper sleep. So make sure you sleep before 10 o'clock, and also wake up early as soon as possible, because if you're sleeping at 1 or 2 o'clock and you're even sleeping for 12 hours also, there will be hormonal imbalance. There can be cortisol intolerance and insulin resistance as well. So try to sleep before 10 p.m. and try to wake up at 6 p.m. or 5 p.m. So make these lifestyle changes to have a better health. What happens if you neglect these fibroids? Remember, fibroids can increase because of hormonal imbalances. Hormonal imbalances can cause other diseases, like if there is estrogen dominance in your body, it can cause a lot of weight gain, water gain, and also it can cause hair fall, your skin to become very oily, acne prone, it can cause endometriosis, it can cause adenomyosis, it can cause polycystic ovaries, it can cause ovarian cysts, it can cause severe dysmenorrhea, and also it will have overall effect on your body, and thereby it can be called as a precursor for this hypothyroidism also to occur, because of the female hormonal disturbances can cause even thyroid fluctuations also. So if you're someone who's neglecting the fibroid can grow really large, and then you have to get admitted. If you're having severe pain, they have to suddenly remove your uterus. If you're planning to get pregnant, then make sure that you decrease your fibroids in the safest manner possible. Do not neglect fibroids, as these can complicate your case, and also can lead into a very bad prognosis. If you're someone who's experiencing fibroids, or if you're experiencing bulky uterus, which is thickened uterine layer, endometrial layer, or if you're experiencing endometriosis, adenomyosis, polycystic ovaries, dysmenorrhea, any of the female reproductive problems, we have high success rates. So we have two types of consultation options here at Fidicus Homeopathy. One being the offline consultation or the in-person consultation option. If you're staying nearby the nearest branch of Fidicus, you can come and consult us in person. If you're staying very far from us, you can contact us online through audio consultation option or through video consultation option. After consultation, if there is any need for investigations, we will let you know. And if you are already done the investigations, you can share it with us. After all the process has been done, especially online clients, medicines will be delivered to your home. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying elsewhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us, message us on this number. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're experiencing fibroids, or if you're experiencing any of the female reproductive organ diseases, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have 3 principles which we strictly follow. The first and foremost one, the main reason for doing this video, because we are having high success rates, and also the patients who come to us are asking a lot of different questions. So in order to educate them and also to educate people, we are doing these videos. We're having good success rate with this fibroids, bulky uterus, it can be endometriosis, it can be adenomyosis, especially polycystic ovaries, or also severe dysmenorrhea. Apart from that, the transparent treatment here at Fidicus, because there is no gray area between the patient and the doctor, the prognosis of the case will be clearly discussed to you. And the personal care here at Fidicus is top notch. You can experience that, because we are doing these videos just because our patients have asked us different questions and we wanted to educate them, and also we have wanted to educate people. So the personal care here at Fidicus is good. We will be educating you on all your queries, and if you have any sort of doubts regarding your condition, if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.